Diabetes is commonly diagnosed in our pet cats. We are going to be covering what is diabetes, what are the common clinical signs that you'll see at home, what are the risk factors for your cat to develop diabetes, and finally, how will your veterinarian diagnose diabetes? To start, diabetes mellitus, which is the form that most commonly affects our pet cats, is defined as persistent hyperglycemia, which means high blood sugar, caused by insulin deficiency. Diabetes in cats closely resembles human type 2 diabetes, both clinically and physiologically. To understand this, let's look at the physiology of energy metabolism. Insulin is secreted exclusively by the pancreatic beta cells. This occurs after meals. A cat eats a meal, the blood sugar goes up, the beta cells in the pancreas release insulin, and as a result, cells are able to absorb that sugar as energy. In cats with diabetes, there's a variable loss of insulin secretion, as well as the potential for insulin resistance, despite it being in the body. This can occur, for instance, when a cat has had inflammation of the pancreas, like pancreatitis. They may not be able to produce as much insulin. As far as resistance, that might be an increased risk in obese animals, which we'll get into later. Clinical signs. What will you see at home? Number one is increased thirst and increased peeing. There can be other medical conditions to cause increased thirst and increased peeing, but diabetes is one of the common causes. Why? Cats, when they have a very high amount of sugar in their body because the insulin isn't secreted or it isn't being absorbed into those cells, blood sugar builds up, it gets high. It starts going out of the body via the urine. High blood sugar basically passes what's called the renal threshold and is peed out. When sugar's peed out, water follows. And as a result, they feel very thirsty. The next thing that you'll notice is your cat is really hungry, but losing weight. They're eating more, but not gaining. This happens because of poor glucose uptake into the cells. The body starts burning other sources of energy, things like fat, muscle. The pet starts losing weight. However, the energy-starved cells signal the brain that they're hungry, so they continue to eat and lose weight despite that. Risk factors for a cat developing diabetes. Number one is age. The average age for diagnosis is 10, and most cats are over 6 years old when we diagnose them. Number two is obesity, being overweight. Obesity increases the risk of developing diabetes by 3 to 5-fold. And statistically, 40 to 60% of the cat population is overweight. The next one is neutering. A neutered cat has twice the risk of developing diabetes, and males are 1.5 times more likely to have diabetes than females. Diagnosis. Diagnosis involves one, noting glucose, sugar in the urine. That should not be happening unless it is so high it's passing that renal threshold and getting peed out. Two, an elevated blood sugar, blood glucose. Frustratingly, cats may have an elevated blood sugar due to other syndromes like stress hyperglycemia. So a scared cat at the vet may temporarily have an elevated blood sugar. To know confidently that they have diabetes, fructosamine, which is the blood test measuring an average blood sugar over the last 2 weeks, can be done. To recap, diabetes in cats may occur due to lack of insulin secretion by the pancreas or insulin resistance due to diseases like obesity. Clinical signs include increased thirst, increased peeing, and increased appetite, increased eating, but weight loss. Risk factors include an elderly age, being overweight, male cats, and neutering. And diagnosis early is key. We're going to note sugar in the urine, an elevated blood sugar in general, and that fructosamine average of blood sugars for the past 2 weeks. The next series is going to be covering how to treat diabetes, how to monitor it, and a bit more detail.